So one thing I like about family medicine is the variety of the scope of practice. It's literally everything you can imagine in medicine. Um, I am someone who kind of craves variety in their life. So when it kind of came to the decision in medical school, hey, do I want to do something that's going to give me a lot of variety versus something where I'm going to see the same things kind of every day? I chose one with variety. That first visit's always a good time to kind of get to know your primary care physician. Depending on what's going on, I really like to educate. I think that in a lot of cases, things that we're dealing with in medicine are complicated. It's a whole different language in a lot of ways. I really like to make sure and take time to make sure that my patients understand, hey, here's why I think that's what's going on. Here's a little bit of background about this condition that I think is happening. Patients that know me well, I flip around the screen in my office or in the exam room, and I'll pull up diagrams, anatomy diagrams, to kind of show them hey, here's what's going on. Here's what here's the anatomy behind the situation. I like for people to be very well armed with information when they leave the visit and during the visit as well. So my kind of one of my primary goals is to keep people very educated about their health. It's nice to kind of see that journey and kind of, I think in a lot of ways, my goal is to get people excited about their health and kind of help them on that journey. I like to think that I have a very approachable personality, very empathetic towards kind of what people are going through, and certainly, I like to get people's own kind of input on their own health because, while I may have recommendations, I always like to kind of, hey, where are you coming from as a patient, and what are your goals as well?